and you vice versa.
Thanks for joining us. My name's Rachael Telleen. I work for A Touch of Grace Hospice. Also joining us is Mardy Chizek with Charism Eldercare Services.
Very good.
Thank you. I've been practicing. Mardy is a nurse practitioner. She, like I said, she has her own business, Charism Eldercare Services, but she also works with A Touch of Grace Hospice. And what we wanted to do tonight was explain a little bit about hospice. We're on every Tuesday from 6:30 to 6:55. And what we try to do is bring on a variety of different people that can share their experiences and how their role in hospice has an impact on patients and families. So that's what we're going to be asking Mardy to do with us tonight. You are watching a live interactive call-in show, so throughout the next 25 minutes, if you have any questions, please don't hesitate to give us a call. The number is at the bottom of your screen, 312-738-1060. Also, we know that there may be situations where the question you have is maybe not one you want to ask on the air. So if you do have other questions, you're welcome to give us a call. It's 708-499-3400. Someone is available to answer your calls 24 hours a day, 7 days a week. So, Mardy, why don't you tell us a little bit, what is the difference? What is a nurse practitioner, first of all? It's not something that it's not a profession that we hear a lot about.
That's true. It is not. Nurse practitioner is a registered nurse who has education that's kind of between a physician and a registered nurse. So my training was actually in the U.S. Air Force. I went to the Air Force after I finished nursing school, and then spent a year working with physicians, learning to diagnose, to treat, to write prescriptions, to be far more interactive, I guess. And one of the neat things about being a nurse practitioner is we are advocates first, and secondly, educators. So we're able to kind of fill in between that nurse, and often physicians don't do as great a job about educating us as they ought to. So I admit that I'm biased and prejudiced because I think nurse practitioners are great.
All right. Well, we're going to get a little bit more into your role, but before we do so, for viewers that are watching that might not necessarily understand what hospice is, would you mind giving our viewers kind of a general overview of how you see hospice, so at least they understand what it is we may be talking about?
Sure. Hospice, there are a couple terms that you'll hear in healthcare. One is called palliative, and one is called hospice, and it's often confusing. Palliative care is what I call comfort care. So that would be care, let's say, that you don't want to have any surgical procedures, you don't want to have any treatment, any major kinds of treatment, chemotherapy or things like that, but you still want to take your medications, you want to go to the doctor, you want to go to the hospital, and you still want to have pretty aggressive treatment. Hospice is palliative care at the end of life. So it is that comfort care, but it's when I have a terminal diagnosis and I know I'm not going to get well, and it is a peaceful way to finish the rest of my journey.
Exactly. And the big thing is that there's no longer that aggressive treatment.
No aggressive treatment. Could be hospitalization. Sometimes we'll go ahead and hospitalize if there is some major disaster, if it will make you more comfortable.
Right.
For instance, I had one patient who had a great deal of fluid in her lungs and was not able to breathe, and so what we did is we took her to the hospital, took the fluid off, so she was more comfortable. So we would not, if you're a hospice patient, we would not anticipate doing major treatment. You'll still take your blood pressure medicine and your water pill and your medicine for your kidney disease or your heart disease, but we would not be giving you chemotherapy, we wouldn't be giving you any aggressive kinds of treatment.
The only one that we ever see that sometimes is confusing, or even sometimes doctors are surprised, someone can come onto hospice though and still receive dialysis.
Correct.
And that one can sometimes, I think that's the only one that I can really think of where it's like, well, that is an aggressive treatment. It's aggressive if you have kidney failure, but what happens is that the individual probably has another issue going on as well, such as cancer. So you could, in that situation, that patient could still receive dialysis, but they're allowing the cancer to naturally progress, and the cancer is not being aggressively treated.
Absolutely. And in the person with dialysis, the dialysis is a part of their living. Right. It is a palliative treatment, just like you would take a pill for your heart disease, for your kidney disease. This is a treatment. So we kind of, and if you have questions, certainly call A Touch of Grace, talk to your physician, talk to somebody that is a resource for you. So don't forget that there are resources out there of people that can help you answer questions, because it's not always cut and dried.
I agree. And sometimes what we've had are patients that get to the point where they're receiving dialysis, but they decide that they don't want to continue living going to a dialysis center 3 times a week. And so what hospice can do is help them to receive that comfort care.
Correct.
During that time.
And I think what's important from a hospice perspective, and what is nourishing to me, is that the patient is in charge.
Yes.
And that is just very comforting to me as an advocate for people, is that we live our entire lives in control of our lives, of our destiny, of our journey, and we end our journey from a hospice perspective in the way we want to end our lives. And you know, we haven't really talked about this, but one of the really tough things is if I choose to be on hospice, but I'm not quite sure how to talk to my family or how to disclose that, and you know, those kinds of decisions can be really tough. I know in my own family, Rachael and I were talking before the show, both of my parents were on hospice, and different processes, but in both cases, my brother, who I dearly love and who loved my parents, really struggled with the decisions that Mom and Dad made to be on hospice. So, you know, be loving and gentle with your family, because we love you and we don't want you to go, but we understand that we need to support you with what's best for you.
And I can share that we've definitely seen that same response with families that we've worked with. It can be a very difficult, trying situation for everyone, and that's what's nice about hospice. Hospice isn't there just for the patient, it's there for the whole family. So it's a support mechanism to help everyone during this difficult time. We've even had situations where the patient says, no, I'm fine, I don't need hospice. And then when we've turned it around and said, well, what about your wife who may be caring for you? And then when they look at it a little bit differently and say, oh, well, yeah, she's probably having a hard time with this.
Well, in my family, as the quote-unquote family nurse, you know, lots of different things fall to us that are healthcare providers. And my brother, when my mother decided no further treatment for her condition, my brother called me and said, Mom, why are you allowing Mom to commit suicide? You know, can't we treat her? And you know, I've told people that, and they say, oh my gosh, you know, what's with your brother? Well, my brother was in pain, and he was hurting, and he just couldn't let go. And so this was not addressed at anything other than him struggling with his own feelings. And families will say things like that, and it may sound hurtful, or it may sound that they don't care, or that's when we're in a very stress-filled situation, death and dying being one of the top, we don't process so well in our brains. And so sometimes things that we wouldn't say or do get said, and please don't take them into perpetuity and think, oh, you know, my brother hates me now and will never speak to me. He was portraying his pain in the only way he knew how to portray it.
But the thing that we need to be aware, I mean, you and I both work in healthcare with families that are dealing with these situations, and we both have personal experiences, and it was difficult for both of us to even come to that. So for families that aren't doing this every day, it's got to be an even more difficult situation.
And I think the thing that is interesting is our society generally does not embrace the concept of hospice. We don't do a good job of talking about death and dying in our society. And it was really interesting. I was in Dallas a few years ago, and there was a sign up on the side of the road saying, "Start your plastic surgery in your 30s. That way you won't have so much to do in your 50s."
Oh.
And I think that really reflects how many of us look at the aging process. And I mean, as I've aged and look at my own life, you know, I feel 20, but I've got this gray hair and these wrinkles, and I'm not 20 anymore. How is this possible?
It's character building.
It's character building, that's right.
Character building.
And so, you know, when I was 50, it was funny. I talked to Mom, and I said, "Oh my gosh, Mom, I'm 50 years old. How's this possible?" And she said, "Let me tell you, I have a daughter who's 50. How does that make me feel?" So, you know,
Right.
we don't enjoy aging in our society, our culture. Other cultures really embrace seniors as
Right.
bringing a lot to the table and as being very wise and sage, and our society doesn't necessarily do that. So, you know, there's cultural issues that come to this hospice decision as well that can be challenging for everybody.
Yeah, no, I agree. Now, as a nurse practitioner, how are you involved with a hospice? What's your role in the hospice?
What I do is I'm out seeing the patients that are on hospice as an adjunct. So the nurse and the caregiver are coming out to help with bathing and care and things like that.
Mhm.
And then I come out as kind of a second level for additional education, for supervision, for planning of care and services, because one has to remember that my education is different than the registered nurse or the LPN that is working with the patient on a day-to-day basis. So I do a lot of teaching, a lot of reinforcement, and within my own patient population, the name of my business, as Rachael said, is Charism Eldercare Services. And so I had a patient that was on hospice, and I did a conference call with the two children who lived out of town, and extensive discussion with them. The patient was dying of Parkinson's disease. And so I went through with them the pathology, what happens when you have Parkinson's, and what we can anticipate with this hospice stay. And when I went, one of the most positive, powerful things that a patient has ever told me is the son said, when Dad would call me, he lived out of town, when Dad would call me and say that these things were happening to Mom, he would say, "Marty said that was okay. Marty said that would happen, so I don't have to worry."
Right.
Marty said. So that's kind of what I bring, is that extra piece. Physicians are not always as open and communicative
Or
as
available.
available, and that's that role, that sort of
Okay.
channel role that I feel.
All right. We have a caller. Oh. All right. Caller, I'm sorry if we kept you on hold too long. Please call back if you have a question. Now, Marty, I think one thing that's would be helpful for our viewers to understand, so your role is so important, but it's difficult for you to see patients if they've only been on the service for a short period of time. So patients really benefit if they're able to receive hospice for longer.
Right. And I think that's one of our challenges within healthcare as a whole continuum, is that we don't, again, culturally, we don't acknowledge the death and dying process. We don't talk about it. We don't embrace it. And often people are not given the opportunity for a really wonderful experience, both the patient as well as the family, and the support, the friends, the neighbors, all the other people that are part of your life. Don't get to participate in it. It really saddens me when I have a patient that I'm working with that is only on hospice for 2 or 3 days, when they could have been on hospice for weeks, if not months, and really it would have been emotionally, physically, psychosocially very embracing for them and their family. And a lot of hospice is for the family.
I agree.
It's very difficult to see someone you love dwindle and become a shell of themselves.
All right. Caller, We have another caller. So, caller, you're on the air.
Hi.
Hi.
I'm calling because I have a question for the nurse practitioner. I wanted to know how often the nurse practitioner comes out to visit a loved one and the difference between a nurse practitioner and a nurse, hospice nurse.
Okay. When we talk about nurse, we usually mean a registered nurse, RN, or a licensed practice nurse, an LPN. Those two nurses have had special training anywhere from a year to 4 years. A nurse practitioner is a registered nurse who then goes for extra training, and it depends on the program. I've been a nurse practitioner since the 70s, so it's a very different system today.
Right.
You would get a master's, which would be 2 to 3 years after finishing up a baccalaureate degree. So they are clinicians that are very astute and clinically trained and high level of clinical thinking. The way the Medicare system works, I come to see the patients every 60 days. So after the initial time frame, I'm out to see the patients about every 2 months. The nurses have called me though at times to ask, maybe the patient's physician is not responding or they're not quite sure what to do. So I have been a counsel resource for them. But it's about every 60 days, and then I'm able to provide the documentation that the patient continues to require hospice services. And certainly from a reimbursement standpoint, none of us want to pay for services that we don't need and that we don't deserve. And that's part of what the role that I fulfill as a nurse practitioner.
Great. Did that answer your answer your question, caller?
It does. Thank you. I appreciate it.
Thank you. Really fast, we do have another caller that we're going to bring on the air, but we haven't stated this, but hospice is free. So these services that we've been talking about, even those that Mardy provides through hospice, she's explaining that there are no out-of-pocket expenses to the family or the patient, and that's why we manage the visits the way we do to ensure that they are covered, so that the family is not having to incur any costs. And all of the services that are provided through hospice, having a nurse come to the home, a hospice aide, chaplain, social worker, all of those services are covered as well. So caller, you're on the air.
Hello, how are you?
Good.
And as I was listening to your response just a while ago, you actually answered my question. My question was, what is the cost for using a nurse practitioner? And you just happened to speak on it already, but you can expound if you want to.
Well,
but that was my question.
But you know what? There is actually another piece to this, and I'm going to let Mardy answer because she also has another component of her business. So Mardy has several roles. So she provides she's a nurse practitioner for our A Touch of Grace Hospice, but then she also has her own business, Charism Eldercare Services. So do you want to explain a little bit how that works for the viewers that might be interested?
Sure.
Well,
thanks.
Yes?
Was there another question?
Well, I was actually speaking about hospice, but please share the other services that you provide.
Well, there's, it's when we have an aging person, there can be many needs that are out there, and families really struggle with when to make decisions and what decisions to make. And so Charism Eldercare Services is a company that is kind of the quarterback for the family. I'm able to pull medical, legal, financial, behavioral health, kind of whatever needs to be pulled together, and do a lot of the same things that I do in hospice as far as communicating with families and pulling families together. It's very difficult to have kids that live all over the country or all over the city as far as that goes, and it's our healthcare system tends to be very fragmented.
Right.
So once you go to hospice, then perhaps other services are not available, or you consume one healthcare service and others kind of fall through the cracks. So in Charism, what we do is pull everything together and really kind of quarterback. And one of the areas that are important to my patients that I manage is hospice. I'm often the person that brings the hospice discussion to the table. I am often the one that will speak to the patient about it, speak to the family about it, speak to the physician about it, and open up that dialogue, which is tough to open up.
Right. Does that
Well, I was actually wondering that I'm glad you spoke about that, because I know of situations, even in my own personal situation, where you have the first thing your loved one wants to know is they're at least able to still make their own decision, is the cost for everything, because as an elder, the trust level for them to trust people has decreased and declined. So, that's why I raised the question about cost, because I know that is, unfortunately, our elders are willing to sacrifice the support and help because they believe everything is, there's a fee associated, even when you say that it's free.
Right. Well, and what I find with the patients I have, my background is all geriatrics, and for those of you who don't know what that means seniors, but seniors actually start at 50, and when I tell my friends that, they all are horror-stricken. So anybody over the age of 50 is considered a senior in our society from a medical standpoint. But one of the things that I think is important is that we often make decisions that seniors are on fixed incomes, and so they don't have the resources to pay for services. I can tell you, and I think Rachael probably could too, with the experience that she had, is that those of us who are the children of those seniors, and those of us that love our parents or our grandparents or whoever that happens to be dearly, will help compensate for additional services that might be necessary. So hospice is in fact free, but sometimes we need other things to make that person comfortable. Sometimes we need other resources, perhaps like me, to help a family that just is really struggling with communicating and is not loving each other like we would hope they would. And sometimes someone like me can step in that consulting role as an outsider and help move things along so that it's peaceful, because no one who is on their final journey wants to see their children yelling at each other across the table. That's very painful.
Yeah, and I think, like you said, it's many times when you see someone who reaches this point, it can happen very, very quickly. And the problem is there's a lot of specialists involved. There may not be, the internal medicine doctor overseeing it all. Right. And I think that's when it can become very difficult. So you have doctors, but you have 4 or 5 doctors. And it's like trying to understand what's going on, and that's someone like Mardy, who has a background as a nurse practitioner, understands that and can actually help to talk to those doctors and understand what's happening to then communicate it back to families. So, caller, did that help to answer your question?
Absolutely. Thank you so much for sharing.
Thank you. All right. Well, we actually only have another few minutes, but I know it went quickly.
Went great.
Yeah. But if you were watching this, and what would you share with viewers that are struggling? It's either for themselves or for someone they love. Maybe a doctor's mentioned it. They just don't know what to do with the information. The whole concept is scary. The word is scary.
I think the first thing is to back up before that hospice decision and have a discussion with the loved ones in your family. Talk about what you want. How do you want to move on to the final journey? If you can't have that discussion, please ask someone to help facilitate for you. Do this as prospectively as possible. Don't wait until you're very, very ill. Please do it now while you're still well enough to have those dialogues. and
I would
share.
say that's when we see families that have the most what's the right word? Discontentment, because they don't understand what their loved one's wishes were.
And it doesn't matter what my wishes
Right.
are. It is all about the person that is on the final journey.
Right.
And I have to respect that.
I couldn't agree with you more. So we are going to leave in just a few minutes. If you do have questions, you can reach us at 708-499-3400, and we will be back next Tuesday at 6:30. Marty,
Thanks
thank
for
you for
having
joining
me.
us.
This
we
was
appreciate
great.
it. Thank you.
I enjoyed.